Hello, welcome to Happy Healthy Hormone Hour with Dr. Shira Raisin. Nice to see everybody. I was going to talk about vitamin and mineral intake is inadequate for most Americans. But then I got an email from a potential client who had a Dear Doctor question for me, and I wanted to share it with you because it represents a lot of the questions I get from my patients. This happens to be a male patient. He says, I've experienced a terrible drop in my sex drive in the last 5 years. It happened almost overnight. I'm single now and I'm okay with it. With no sex drive, I've no desire to meet women. I'm curious what your clinic could do about that and if it's something you can focus on. Can it be helped? So this is a great question, men and libido. So even though I specialize in hormones, I like looking at an overall health of a person because one area in the function of sexuality for men is erections. To have a healthy erection or good erectile function, a man needs good blood vessels in his whole body. So if he already has heart disease and diabetes and hypertension and a bunch of meds for that, he might have problems with erectile function. Then if he's on a bunch of medications for psychiatric issues like depression or anxiety, those can mess up his performance as well. And then I think Shakespeare said something about alcohol. So that he said something like, alcohol improveth the desire, but decreases the performance. I'm paraphrasing. But alcohol and other drugs can really impair a man's sexuality, both in his libido as well as in his performance. However, if you come to my clinic, to my office, I would do a lot of blood work and on the first visit and get a lot of information. So first of all, how is the adrenal gland functioning? So the adrenal gland is all about our cortisol, our flight or fight response. So if that whole part of your body isn't working, your cortisol and your adrenal glands, you're not going to make testosterone. So that's a problem. If you're not having enough testosterone, you're not going to have the same desire and maybe even the same, again, erectile function. Other things have to do when the testosterone goes low is essential sense of assertion, being assertive in the world. So that's not very sexy if you don't feel assertive. And sometimes men whose testosterone is dropping, their muscle drops. So even though they might be working out, they don't have the same muscle mass, and then they can get that belly or even breast tissue, which again for men isn't very sexy. So a lot of men, if I test them and their testosterone is low, I will actually put them on testosterone creams according to a very interesting rhythmic cyclic protocol that I use with patients. So I have a patient who's, he's in his 70s, and he came to see me, and he was on. Started him on the testosterone. He goes, "Oh, doctor, it was too much. I was like too happy, too much energy, too much sexuality. I cut back on it." And I said, "No, you don't want to just cut back on it. You want to come to see me, and we'll change the dosage, not really the timing." So anyway, we fixed that up, and he's very happy. So the other things we do want to look at are human growth hormone levels, DHEA, which is the youth hormone, and also a male hormone, and then thyroid. So thyroid, if a man's thyroid isn't working, he's not going to feel good. He's not going to feel energetic. He's not going to feel cognitively, at his best. So he's not going to want to go get the girl, and he's definitely not going to want to perform sexually. So you need the thyroid working, you need the testosterone working, you need the DHEA working, you need the human growth hormone working. And then one of the things that I'm testing on everybody now is the methylating gene. It has a big name, so we just call it the MTHFR gene. So if people have that gene defect, which is not uncommon, they need special methylated B vitamins and special methylated folate to take, because they just cannot methylate, they cannot do it, their body cannot do it themselves. So people who have that gene have a tendency to not make their own hormones and their own neurotransmitters. Well, if you're not making your neurotransmitters like dopamine, which is the love neurotransmitter, And you can't make your testosterone, which has to do with virility and a sense of assertion and erectile function, then who's going to want to have sex? You have no methylation, you have no testosterone, what's going on? So I like doing a test on people's micronutrients. So in one blood panel, or a fasting blood, fasting urine together, I have a bunch of different labs I use to get the information. What nutrients are functioning in your body, what minerals, what amino acids, and which ones are you lacking in? So a patient who, like that one who wrote in saying, please help me, I want my sex drive back, I would look at his overall heart function, I would look at all his hormone levels, I would look at his nutrient levels, I would replace everything that's low. If he's overweight, I would get him on a slow exercise program. I would definitely do the Renda Clean, Burn, and Shape cleanse, and get his whole liver cleansed and his gut up to par. In our intestines, in our gut, everyone's heard about the microbiome, which is a fancy way to describe all the bacteria that help us digest our food, but they also help us make our hormones, like converting the storage form of thyroid into the active form. And ironically, if you eat too much fiber, you absorb too much of your own hormones that are supposed to recirculate. So on that note, this is what I want to say. If you're a man and you want to have good sex, get all your hormones checked, not just your testosterone. So your adrenal hormone, your human growth hormone, your thyroid hormone, your female hormones. Get all your nutrient levels checked. If you don't want to do a fancy test, get your iron panel, your B12 panel, your folate, your magnesium, your vitamin D levels. Definitely get your MTHFR gene mutation checked, or to see if you have the gene mutation. It's called getting your genotype. And these things are great, and while you're doing that, get on a really good multivitamin, multi-mineral. Probably my favorite is the Orinda Ultimate Pack for Men, because it has a few little herbs and things in it that help you make as much male hormone as you can. And it has just enough selenium and iodide to get your thyroid rocking and working correctly. And then fish oils are really important for your mood. So if you think your erectile function, your sexuality, and that dip is from either inflammation or from depression, at least get on maybe two soft gels of fish oil twice a day. I love from Metagenics, they make an enteric coated, which basically means you don't burp up fish oil. So take 2 of those twice a day. Get on the Orinda Ultimate Pack multivitamin package. Do a cleanse and get all these labs checked and get dosing or supplements or prescriptions for the things you're low in. If you have any more questions, come in and let me check your blood and I'll tell you what's up. Take care.